Sorry, Maura, I got ahead of ourselves. I'll say again that this is the first HHS capacity building workshop of 2024. And today we're talking about evaluative thinking, a foundational skill for evidence building. And today's session is the first of an 18-month series, so plenty of time to come to the rest of them. Created based on the feedback of the evidence building community across HHS. All of these trainings will be recorded and sent to you after the event. So we hope that you will do us the kindness of filling out our evaluation survey. It is very short and very excellent. Afterwards, so that we can continue improving our trainings and our processes for these events. So this is the ASPE evaluation team. Made up of myself, I'm Chrissy Hutchins, Maura Riley here, and of course our fabulous EO Evaluation Officer, Susan Jenkins. And without further ado, I will introduce our speaker for today, Susan Jenkins. Susan serves as the Director of the Division of Evidence, Evaluation, and Data Policy in the Office of the Assistant Secretary for Planning and Evaluation, or ASPE, and serves as the HHS Evaluation Officer. She oversees adherence to the HHS reporting requirements under the Foundations for Evidence-Based Policymaking Act, facilitates the HHS Evidence and Evaluation Council, or E&E as we like to call it, and supports both the HHS Data Council and National Committee on Vital and Health Statistics. She was named the Data Foundation's Evaluation Officer of the Year in 2023, and she is a member of the Interagency Council on Evaluation Policy and is faculty in the American University School of Public Affairs. Prior to joining ASPE, she was the director of the Office of Performance and Evaluation in the U.S. Administration for Community Living, served on a detail with the Office of Management and Budgets evidence team, and was an evaluation specialist with the U.S. Peace Corps. She received her BA from Yale University, where she was also on the fencing team, and her PhD in social psychology from the University of Michigan. So without further ado, I will turn things over to Susan to tell you about evaluative thinking. Susan?
Thank you very much. And Maura, if you can share our slides. As Chrissy mentioned, we will be talking about evaluative thinking today and the importance of thinking in a critical way, an evaluative way, to promote and nurture evaluation and evidence building more generally. I will talk a little bit about what is evaluative thinking and then have a number of tools and experiences and things that you all can do to promote evaluative thinking. Next slide. So this session will be an interactive walkthrough of approaches to engage staff in discussions that support evidence-based rather than impulsive decision-making. Specific approaches highlighted will be opening questions, which are questions to help challenge programmatic and policy assumptions, reflective discussions, which is a communication approach that helps to cultivate personal contemplation and reflection, build community, and build capacity for open and active listening, and some other tools that I will talk about and explain how they can be used to enhance evaluative thinking are logic models, timeline mapping, and data placemats. And links to the resources will be shared with the slides after the session, and we will put together a sheet with some additional materials that when this presentation is posted on the HHS Strategic Planning Resource Center, those resources will also be posted there. Next slide, please. This session is intended really for everyone. And so we think specifically for early evaluators. Those are evaluators that have been in evaluative practice, particularly federal evaluation, for less than 5 years. We think that experienced evaluators can also gain from this, as well as program staff. One of the points that I would like to make is that everyone can and should be an evaluative thinker, even though everyone does not need to be an evaluator per se. And so the learning objectives are that at the end of this session, you'll be more aware of the value of evaluative thinking as a form of critical thinking, and you'll gain familiarity with some tools that you can use to increase your own evaluative thinking as well as the folks that you work with. So we have a poll to get started to find out where you fit in terms of the audience type. Are you an early evaluator, Are you an experienced evaluator? Are you a performance officer, strategic planner, risk management staff, who are other folks that typically build evidence? Are you program or policy staff or other? And so while many of us wear many hats, we would ask that you use the one that best fits you. And so select one of those options. And that'll give us a good idea of who we have in the audience. So we'll leave it open for a few minutes to let folks let us know who you are in terms of these categories. And then we will share with you so that not only do I know who we have here, you all know who we have here too.
All right, we're about 85% participation. So another 10 seconds, get your final answer in. All right.
Okay, so we have a nice breakdown of various different people, almost equal, between early career evaluators and program or policy staff, a good number of experienced evaluators, and some other folks. So in terms of folks that said other, if you want to put in the chat who you are, what your type of role is in your agency, we would really appreciate that. So continuing on, then let's go to the next slide and start the definition of what is evaluative thinking. So evaluative thinking is a form of critical thinking motivated by an attitude of inquisitiveness and a belief in the value of evidence. Can we move to the next slide? It involves a number of things, identifying assumptions, because many times, whether we realize it or not, we are building our evidence based on a number of assumptions in terms of what might be the best evaluation question or research question. Why is there a link between doing A and getting the results of B? So we have a number of assumptions. And so evaluative thinking is designed to help us to identify what those assumptions are, posing thoughtful questions. So not just questions about the surface of a program or policy or why we're doing something, but really digging deep, getting into the nuance and looking for what might not be obvious about the programs or policies. Pursuing a deeper understanding through reflection and perspective taking. So not just looking at things from our perspective, maybe as an evaluator or program officer or a strategic planner, but also taking perspective of the other folks that have an interest in the policy or program. That might be the funders, the people that are recipients of a program or affected by a policy. So really taking perspective and reflecting on our own beliefs and understandings, as well as those of other interested parties, and informing decisions in preparation for action. Because the purpose of evaluation is always action, not just to have a giant report that sits on a shelf. So as we think about evaluative thinking, it's critical thinking plus these proactive behaviors of posing questions, seeking evidence, and deciding to act or not to act based on that evidence. And so it relies on systematically collected data and evidence, but it also helps us to challenge belief preservation, a natural phenomena that happens for most people where we've built up our beliefs over a period of time based on maybe education, based on experience. And it is hard as people to really question those beliefs or change those beliefs based on new evidence that comes up. And so evaluative thinking can help us to do that and think in a fresh way, take a fresh look at things. Next slide. Key components include asking questions of substance. And so those are open-ended questions that help us to work through the how and why our programs and policies work or do not work. Determining what data we need to address those substantive questions, not just what data we have, but data we would like to have. And this process can help us to build to an evidence-building plan or learning agenda, and to really help us to develop a strategy for data collection and for evidence building. It also involves gathering data in appropriate systematic ways, which involves balancing rigor and burden, and being realistic about using the most rigorous methodology possible and feasible, but being careful and transparent also about understanding the data quality and the usefulness to help us to make sure that we're not misusing data or using data to make decisions when those data are really not sound enough for the level of decision that we're trying to make, or vice versa, that we really do have sufficient evidence to make those decisions. Another component is analyzing the data and sharing the results, being reflective about what recipients of the data want and being creative in meeting those needs. So if you're an evaluator, you may conduct an evaluation or oversee an evaluation for program staff, a unit or component in your agency. And so being creative about understanding what they want, how they want to receive that information, and making sure that what we give folks is both rigorous, but also useful. And the last component is developing strategies to act on evaluation findings. And so that can involve developing strategic plans to help us to move towards meeting the goals that we have and reaching those outcomes, and feedback loops around the program and policy, but also around any evaluative activities or evidence building activities that we do. Next slide. For the purposes of evaluative thinking, as we think about the context of evaluation, there are a number of things to think about. Formal evaluation as well as informal evaluative efforts fit in here. And so some of those informal evaluative efforts can be evaluability assessments or other pre-evaluative work, developing logic models, as well as timeline mapping, two of the things that we're going to be talking about later in this session. And so as we're doing program planning, policy planning, we can also use evaluative thinking. So not just with formal evaluations. We can also think about the types of activities that inform or improve organizational, programmatic, and policy actions. So that can be standardization of data collections. It can be making sure that we can link data across different areas to get a better picture of the people or communities that we're serving. And so creation and use of comprehensive translational implementation materials and other things that are based on evidence building that can help us to improve our programs and policies. And for those of you that know me, relentlessness is one of the terms that seems to be associated with me very frequently. We need to be relentless in both thinking about the so what, but also the what if. So as we think about a program, we think about the outcomes, that's the so what. So what happens if we do these activities? But we also need to challenge our assumptions and look for alternative explanations, and that's the what if. Just because data may fit a certain hypothesis that we have, or may be pointing in a certain direction, we do still need to be very rigorous and relentless in saying, well, are there alternative hypotheses that these data equally well fit? And then thinking through those, working through those. And then we also need to be relentless in generating conversations through opening questions and reflective discussions with all of the interested parties with a program or policy. And so that's the evaluators and other evidence builders. It's the program staff, the funders, leadership, management, the people that are receiving or affected by the program or policy, and just generating those conversations, reflecting on things so that we can improve the programs and our knowledge and evidence about those programs. Next slide. The ultimate point really is that evaluative thinking is not the same thing as evaluation practice or evaluative practice. To be an evaluation practitioner, there are certain training requirements, certain skills that are needed, but everyone can be an evaluative thinker. An evaluation practitioner should be evaluative thinkers, of course, but everyone can be an evaluative thinker. And so we can always have that evaluative cast of mind, skeptical questioning, perspective of the reflective practitioner. When I worked at ACL, we had a competition called Friends of Data. And what we did was we had certain people that really were champions for data, and they were interested in evaluation of their programs and better understanding how their programs work through data. But we also had folks that were not interested in having us evaluate their programs and were hesitant or hostile, to be honest. And so with those friends of data, the people that really were speaking out and champions for evidence building, we would ask them why they were friends of data. We would write blurbs, we'd give them a little prize, a button to say that they were officially friends of data for ACL. And we posted those things so that we could show examples of friends of data who were not statisticians, were not data scientists, were not evaluators per se, but they could still be friends of data. They could still think evaluatively to try to bring everybody together. And there's a quote here from Michael Quinn Patton that tries to highlight some of this, that evaluation is an activity that produces reports. Those reports should lead to action, but evaluative thinking, on the other hand, produces effective organizations. Thinking systematically and critically about what we do, why we do it, how we expect it to work, what outcomes we're looking for, can help us to improve the whole organization, the whole community, everyone that we're touching with these programs and policies. Next slide. We're going to start with some of the tools that you can use. And so opening questions is something that we can use, particularly with program or policy owners, if you will, the people that are running the programs or implementing the policies, particularly when they're not supportive of an evaluation. They can be used in other situations, but they can be particularly helpful in bringing people over to the side of thinking critically about a program or policy. And so generally the questions start with what? They're open-ended questions. They should be non-biased questions, so they're not leading in one direction or another. What is wrong with this program is not a good opening question. What do you think about this program? Can you describe this program? What is the theory behind this program? Some of those open-ended questions are less biased. And so, for example, what does the program do? What is the program or policy designed to do? And then you allow the respondent to answer. And people that have a belief or a vested interest in a program, they generally really like to talk about what the program does. And you can many times gain information that you wouldn't get from the written materials or the guidance about the program from talking to these key informants and experts about a program or policy. Why and how can also be good ways to start opening questions. So for example, why was this program or policy implemented? That helps you to get at what was the problem it was designed to solve or the challenge it was designed to meet. Or how do you describe this program or policy to funders or recipients? Getting people to describe it sort of in a third person view might give you a different view of the program. And that helps to build the trust and relationship that is necessary for a good evaluation. The next slide talks a little bit more about opening questions and gives you some more information. And if you look at the bottom of the slides, you'll see links to other resources related to each of these topics. But you can use opening questions at any point in the programmatic development or policy development and implementation, or any point in an evaluation. So if you think about when you're planning a program or planning an evaluation, some of the questions might be, why are we doing this? That helps you to get at what the problem is or the outcomes that you're trying to reach. What has been done before? So you can get a sense of, well, what has been done that has worked and we should do more of that? What has been done that has not worked and we don't want to do those things? And how will we know if we're successful? And that helps to identify what might be performance indicators, outcome measures, things like that. In the doing phase of a program or policy, are we implementing according to plan? What else can we do to achieve our goals? We should always ask what else or what if. And then in the review phase, so at the end of an evaluation or after the program has been running for a while, the policy has been implemented, what difference is this making? For whom is it making a difference? Not everything works for everybody under every situation. And so getting at some of that nuance is very important. And what should I do differently? So again, how, why, and what questions, open-ended questions to get people to talk about the programs and policies that they're implementing so that they're thinking more critically about them and we know more about them as we do evaluations. Next slide. And this shows some more opening questions, and really you'll know that you've started to tip the scale toward evaluative thinking when you're in meetings and people start to ask these questions on their own. Why are we assuming X? How do we know X? What evidence do we have for X? So if we on a regular basis continue to use evaluative thinking and use these questions in various meetings, if you meet somebody in the elevator, any of those types of things, and you're relentless in asking some level of evaluative question, other people start to think evaluatively and start to ask these questions themselves. And so these are some other questions that you can think of for opening questions. The next slide, then, I have some questions for you all to put in the chat in terms of what are some opening questions that you might ask or have already asked when you start an evaluation engagement or you're learning about a program or policy. Maybe you're new to a division and you've been assigned some new programs new to you. What are some opening questions that you might ask, and what are some of the important groups to engage with through opening questions? So folks can put some information in the chat, and that would be great. Who are our stakeholders? That is an excellent question. Melissa, I see your hand up. If you want to speak, that would be great. And I see some other questions coming in. How does this align with a larger strategic vision? That's an excellent how question. What are we hoping to accomplish? Who else should I talk with? Who else should I speak with? What do you see as the greatest value of the program? And that is an excellent question, because people who are working on the program, they generally see a value in it. They want to brag about their program. And so starting with what do you see as the greatest achievement of your program allows them to speak about that, shows your interest in that. And then you can get to some of the more difficult questions. What isn't working, or how could it work better? But those are excellent opening questions. The next slide then takes us to reflection and perspective taking. So another way to approach this, and here are some general principles for participating in reflective discussions. Listen carefully, and so active listening. Listening to hear something new, listening fully, and helping you reflect. And so not just listening to answer or listening to challenge, but really listening fully, because the goal of reflective discussions is individual reflection so that you may learn something new, or you may change some of your own, challenge some of your own assumptions, and to help clarify what you're learning about. But it's also community building, because there's a give and a take, a back and a forth, and it builds that trust again that is required for a good, strong evaluation. So the purpose is not consensus building or problem solving or decision making. It's learning, reflecting, and absorbing. Some other principles are to maybe do things differently. If you're normally somebody who goes on in discussions and maybe dominates the discussion, sit back and listen. Don't be the first person to speak. Don't be the person that speaks the most. Listen and give other folks that may be more hesitant to speak that chance. And you may hear things you've never heard before, or from people you haven't heard from before, and learn a new perspective. And vice versa, if you're someone who has a tendency to be more reserved and quiet, challenge yourself to provide your information. You're on that team, in that meeting, on that staff for a reason, because you have expertise. You have a perspective that is important. And so it's good to share that. And so we have another poll to find out from you all, what type of person are you most often? Poll number 2. Are you someone that goes on in discussions, or are you someone that is generally reserved? And so a little bit of this is to help you to reflect on your general role in meetings and think about maybe taking that opposite role in your next set of meetings. And then as you see also the rest of the slide, there are some other general principles that go along the same line in attempting to understand the views of others, taking other perspectives, and not just taking the easy solution, but digging deeper. Why? How? Is there another answer to this? Do these data take us in another direction? Is there another way to look at this, another cut that we could take of the data? And so, Maura, can you let us know how we're doing on our poll?
About 70% participation. So again, 10 more seconds, and then we'll close the poll.
Okay, and I am going to guess many evaluators are reserved. I have met a lot of evaluators that tend to be more introverts and things like that. So I'm going to predict with no evidence at all. And I was right. So I brought up my assumption that was that we are generally reserved as a group of, types of people. And I have some now evidence to support that. But really being reflexive, then I would ask, what does that mean? What does going on mean? What does it mean to be reserved? Are there different situations in which we are more likely to go on and more likely to be reserved? And I see some people already answering that. I'm reserved unless I'm in a group of other introverts that don't speak up. So yeah, it is also context dependent, of course. Thank you for participating. Another tool that you can use for reflection and perspective taking on the next slide is called thinking hats. And so you can have literal hats or you can have figurative hats where you assign different individuals or groups of individuals, depending on the size of the group that you have, different perspectives. And so here are 6 possible perspectives, but you might have other perspectives that make sense for your particular program. But somebody who engages in the conversation from a positive perspective, finding all of the positive elements, taking a positive interpretation of the data. Somebody else then would take the role of being creative. What are some other ways that we can think about this? Some other data that we could look at, some other interpretations of the findings, being very creative. Somebody that looks at the big picture, somebody that looks at the facts, not the interpretation of the data, but literally what are the data that we have and just laying them out without any interpretation. Somebody that takes a negative perspective and somebody that takes an emotional perspective. Well, this is how I feel about the program. This is what the program means to me emotionally. And so playing those roles, one, it challenges our own perspective of how we might think about a program or policy or evidence building endeavor. But then also by doing this as a group activity, we start to see other ways of seeing things. And like with any type of focus group or brainstorming, you start to build some new understanding as a group, and people can sort of riff off of each other. Oh, okay, I hadn't thought about that positive interpretation. That also could be, and then they move on from there. So thinking hats can be a fun way of structuring some of those conversations. The next slide, and this is another question for you all to put in the chat, or if you want to come off of mute and say, whose perspective needs to be accounted for with these 3 examples? So the first example is a project that I worked on years ago with the Department of Justice, delivering hygiene products to juvenile detainees to help them present a neat and tidy appearance. There was research that suggested that when defendants come to court, if they look neater and more well-kempt, they tended to get more favorable outcomes, that there was a bias, a prejudice against people that did not look well-kempt and neat and tidy and had good hygiene practices. So as we think about delivering hygiene projects to juvenile detainees, who are some of the folks that perspectives that we might want to take? And to help you to think about that, I will let you know that this project was a real project. They did start to deliver the hygiene products, but what they found was actually it intensified the disparities between Black youth that were in the detention system from other youth that were in the detention system. What perspective may not have been taken into account that should have been for this particular project? And so someone mentioned, yes, the detainees. Absolutely. What products do the detainees want to use? What works well for them? And that really was the answer, that the hygiene products that were brought from one perspective. Not all people have the same hair types or have the same skin types or other things like that. And so there needed to be a greater diversity of the hygiene items. And so exactly, as folks are saying. Another question then is a nutrition program at a school. Who are some of the perspectives whose perspectives might not normally be taken in developing a nutrition program at a school? The children, the students, yes. Yeah. And also thinking about different needs related to nutrition in terms of religious preferences, in terms of allergies, the lunch lady and the available infrastructure. Absolutely. We can develop the best menu in the world, but if the foods aren't available or the staff don't know how to prepare them or the stoves and the kitchen setup won't allow for it, that program is not going to succeed. And so, yeah, these are exactly the types of perspectives that I've seen taken into, and cultural perspectives as well. Absolutely. And then in efforts to increase clinical trial diversity, what are some of the perspectives that we should take when we think about programs that are designed to increase clinical trial diversity? What do people think about those types of efforts? Who might be folks that we don't typically bring into those? Patients and researchers, figuring out how to get past mistrust of these efforts. Yeah. Historical trauma was one of the topics that I was thinking about, people that have been mistreated by the medical system, for example, community, people with distrust, women, older adults, people that may not be the normal participants, the majority participants. And by majority, I mean the people that are the most likely to be in the studies. Yeah, work schedules, exactly. Can people actually participate? Transportation. So there may be structural barriers to participating, and there may be cultural barriers, and there may be researchers who are looking at one group of people because that's the type of group they've always looked at and not bringing in other groups of people. Geographic location, absolutely. And so we are engaging in evaluative thinking now by trying to broaden what we might normally think about. And so with our next slide, we're going to move on to our next tool. And I imagine that most people have used logic models. It's a very common tool, but there are a couple of things I want to talk about with logic models here. It's a good tool for explaining how a program works and communicating about how a program works, but the process of developing a logic model can be extremely valuable for evaluative thinking, because working with program staff, policy staff, funders, recipients of the program, all of these different types of people we were mentioning last time, whose perspectives we need, bringing those people together to talk about the logic of the program. Those conversations, we may find out about unintended consequences that are very important to recipients of the program or people that will be affected by the policy. And maybe those should be things that we either try to avoid because they're negative unintended consequences, but sometimes they're positive unintended consequences. And maybe we want to add those into the actual explicit logic of a program. So those conversations can really bring people together. The next slide talks a little bit more about what goes into each of those areas. The inputs are the resources that the program uses to carry out, activities, what the program actually or policy actually does. Outputs are the counts of activities. And then the outcomes are the changes that occur in the people, the communities, a result, the so what of the program or policy activities. And various people with interest in a program or policy may have different perspectives. And so you can start your logic model program or your discussion about the logic model. You don't have to go from left to right. You don't have to go from inputs to outcomes. You can start wherever people are, what they know the most about. And so as we think about staff of a program, staff that are implementing a program, they may be focused more on the activities. They are implementing the program, they're conducting the activities. So asking them about what are the activities that happen in the program might be the perfect starting point for a discussion with them about the logic model, because that's what they think about the most. And they may be counting their outcomes. So that may be, again, a good starting point. And then you can work to the other parts. You can work outward to the other parts of the logic model. Funders or budget staff may have more information about the inputs. So for those staff, you may start with the input side and then go to the right-hand side to finish out filling out your logic model. And recipients may best understand the activities that they're participating in, but also the outcomes that they are experiencing. So you can start at one of those places when you're having conversations with recipients of a program or people that are affected by a policy. And so the logic model itself is a nice visual representation of how and why you think a program or policy works, what it's supposed to do, but the process of it can really be a good evaluative thinking exercise. The next slide shows a little bit of a different view of a logic model. And so it puts in place, it has the same basic categories, but it talks about what are some of the common inputs, outputs, and outcomes. And so it also includes the bottom section that talks about external influences, environmental influences, and executive leadership may have that bigger picture view as to why this program is being implemented or policy and how it fits in with the rest of the agency or the rest of the initiatives for that population or community. And so they may be very good at filling in that bottom part about the external influences, which are also important because particularly if you find that you have outcomes that vary over time, that go up, that go down, having information about those external influences, the context, and some assumptions can help you then to explain and interpret your data in a better way. And so that's also another way to bring in some of the executive leadership into the conversation and help set expectations around the evaluation projects that you may be conducting. The next slide shows another version of a logic model. And I like logic models a lot. And I like to show a lot of different models because different people react differently to the different models. And no one of these is correct. There are different ones that might be useful to you, but also this source that's listed here is a really good source for a lot of information about logic models. And so I do like to show this particular version as well as reference this particular source. And the next slide shows a different type of logic model, the same source, because as I mentioned, they have a lot of different types of logic models in this one source that you can pick from. But this type of called a Z model, I believe, is particularly good when you're looking at system change types of programs, where they have several levels of activities to improve before you actually get to the outcomes for people or communities, things like that. So if you think about how care is provided, for example, and that could be healthcare, that could be human services, on row A, there might be the identification of best practices. That might be the activity. And then output A would be having those best practices for delivering this type of care. Those best practices become the resources for row B. And then having those best practices, the activity may be training the staff that are going to provide the care. So then the output for row B is well-trained staff that know how to implement the care using these best practices. Those well-trained staff then become the resources for row C. They are delivering care according to a new standard, which then might lead to the outcome on row C of more people receiving high-quality care that results in healthier communities, fewer hospital infections, reducing disparities in health outcomes, or any range of health outcomes that are relevant to that particular program. And that gets you to that box of strategic program results. And so the process, again, of working jointly to fill out the logic model, and there might be more rows than just these three. There might be D, E, F. It depends on the complexity of the program. But these conversations help to really clarify what the program does and what all the different dependencies are so that you can conduct a sound evaluation. The next slide takes us on to our next tool, timeline mapping. And again, it's a nice way to engage people in a conversation about a policy or a program or an initiative, a broad initiative. I've used it with a broad initiative, but people use it for long-term programs or programs that follow a life course, for example. And so it's another way of engaging people and thinking about their programs or policies. It helps us to identify some of the assumptions or contextual factors that may affect why a program is implemented, how it's implemented, for whom it's implemented. And it can help us to understand variations in the outputs and outcomes over time, because many times external factors do play a role in how successful a program is or is not. And then these timelines can also be very helpful for justifying federal budgets and useful in federal budget discussions and strategic planning. The next slide talks a little bit more about timeline mapping. And in order to do timeline mapping, you need to have a time orientation. So you need to start with a start time and an end time to be able to map what happened during that period. But also you need credible informants. And these may be folks that aren't normally involved in evaluation, but have a lot of information about a program, how it works, why it works, how it has changed over time. And so they can give you information about what has happened over time to affect the program or policy, and by giving you information that helps you to understand the context, the connections between different events or different programs, and different patterns that you see. Maybe as new funding sources are offered, you see an explosion of new program, new recruitment, and so you can look for different patterns but are also based on time. The next slide talks more about timeline mapping. And so the steps basically are you select a topic for your analysis. It could be a program, it could be an initiative. There are a lot of different things it could be. Determine who will participate in the timeline mapping. Who are those key informants? Set a scale of analysis. Are you going to look for events that happen nationally? Does it happen only within a state, within a region, within an organization? What events are most relevant to what you're talking about? And then you set a timeline for the analysis to capture that relevant history that happened at that time. The next slide shows an example of a timeline map. In doing a cross-HHS evaluation of the overdose prevention strategy, we started with a timeline map. And so we started by talking with key informants about HHS's approach to overdose prevention and decided to start with when CARA was enacted in 2016. Our key informants told us that, from the 40 years previously, this was the new biggest change in regulation in law, or I should say law, related to overdose prevention. And then the next year, the opioid crisis was declared as a public health emergency, and that made changes to what HHS could and should do and the focus on opioids particularly, which are a large proportion of overdoses. Then the Support Act was enacted. And as you go down the timeline, each of these different actions did have an effect on how HHS thought about, focused on, and addressed overdose, and had differences in overdose numbers, overdose treatments, a range of different things. And so the timeline can help us to frame and contextualize what we're doing with the people we're working with on the evaluation, folks that are working in overdose prevention at HHS, but then also as we talk to other people about it to help to contextualize it for them as well. And the next slide is the last part of timeline mapping, and it shows a little bit more about what you do in developing timeline mapping. So after you have your timeline, what are the themes that the timeline shows you? Are there themes about cycles of funding? Are there themes about other areas of focus? What questions or implications does this timeline raise as we think about building evidence on this topic? And what is not there that should be on our timeline? And so getting more key informants involved and understanding the program, the initiative, the policy. And we should think about revising our timelines or revisiting them periodically, because as time keeps moving forward, you need to update the timeline, or we may realize that certain things that happened previously have more of an impact on our outcomes than we would think that they would. And so you might add new things into the timeline. The next slide starts us on data placemats, our last tool for discussion today. And it's a facilitative technique, again, bringing people together to discuss things, but this happens at a different phase of the evidence building. It happens during the analysis stage of an evaluation. And so it's designed to help to bring in interested parties and help them to understand and provide insight into the data that we have, help us with our interpretations, help us to point out what are the most salient findings, what are they most interested in, how to group and think about the data. And so it encourages that interaction on both sides and co-creation between the evaluators and the evaluated. And it's a really nice conversation starter. It's an active process. The next slide shows a basic template for a data placemat, where at the top you have the theme of this particular placemat, you have your charts and your graphs, and then you have your supporting quotations. So it's also a very nice way of bringing in quantitative data for your charts and your graphs and any other data visuals, but also qualitative data, qualitative information that can help us to understand, give us context and nuance for the data that we're seeing. The next slide shows an example of some data placemats. One is organized by demographics. One is organized by career background because of the types of programs that it was pulled from. And one is related to experiences in the program. And so as we think about our focus in the federal government on customer experience, then this may be something to think about as we put the data together there may be a nice way to bring that in with data placement exercises. So as we're getting closer to the top of the hour, I want to do a brief recap. And here are some places, some ways that we may think about when and how to use these tools. You can use them anytime that it makes sense for you, that you want to use them. But generally, you might use opening questions in the planning or evaluability assessment phase, reflexive discussions at the start of each stage of an evaluation to reset and bring people into the process. Logic models are good for program and policy planning and identifying outputs and outcomes that you may focus on in an evaluation or performance measurement system. Timeline mapping is related many times to long-term initiatives or programs that chart life course and life events. And data placemats are for the analysis phase. So I have 2 more polls now. Poll 3 is, how many of you have used each of these tools? I'm going to guess that many of you have used logic models, but people may have used other ones of them. And so I'm curious to know if you've used any of these tools. I'm most used to timeline mapping and logic models from what I've done, but I've heard very good things about data placemats, which can also be done as a sort of data walk sometimes, where people walk around, like when you have a poster session at a conference and people are walking around looking at the data, moving things around, that kind of thing. And some of these things can be done virtually. There are a lot of different types of software that can be used for moving things around and for co-creation. But Maura, how are we with responses? Okay, logic models. So I was right. I was not right that opening questions was one of the most popular ones that people have used. So that's great. So let's move on to the next one. Which ones are you most likely to use? And so what are you most interested possibly in trying or learning more about? Because I've given you just the briefest brush on these things. And so, you can look at the resources, you can look up other manuals and things like that. But what are you most interested in trying as you move forward to improve your own evaluative thinking and to help others to improve their evaluative thinking? And looking at the chat, I see that Chrissy has exposed me that yes, I love the logic model. And elements models on previous slide also provide some other possible terms to use if inputs, outcomes, or outputs are off-putting. And that's absolutely right. And so I see here, data placemats. I like it. That is the one that I am probably most likely to try as well. I like visuals quite a lot. So thank you so much for participating in those polls. So we're going to wrap up with just engaging staff in new ways of thinking. With any skill, for ourselves and for others, we just have to keep practicing it incrementally, step by step. And it has to be practiced routinely and intentionally and transparently. And ideally, everyone should have at least somewhat of an evaluative mindset. The next 2 slides give you some ideas about how you can promote or know if you're promoting evaluative thinking. So there's some points here, organizational leaders, and we can all be leaders, either big leaders or small leaders, but we can all lead something. Leaders who use evaluative thinking will support and value evaluation and evaluative thinking, use evaluation findings in decision-making, and so on and so forth. So you can look and see where you might fall with some of these things and what you want to work on. And then the next slide, do you promote evaluative thinking? And so thinking for yourself and reflecting on your own self, are you open to questioning various perspectives and plausible alternatives? Do you create a trust-based, safe communication area for staff that you work with? And it could be your staff, or it could be partners that you work with. It could be grantees. It could be anybody. But do you create that safe space so that people can come to you with alternative explanations or other things like that? Do you demonstrate reflection? And so my observation indicates, and you have to think about how to say this authentically for your own self, but, try to be reflective yourself and speak in a way that shows that, and reward evaluative thinking. So if someone comes to you with an alternative approach or explanation, dig into it, give it some respect, look into it more, don't brush it off, and really reward that evaluative thinking and highlight that where you can. And the next slide then takes us to questions. So if folks have any questions, we have a few minutes, you can put them in the chat. And the next slide gives you our email address, evaluation@HHS.gov. So if you have questions later, you can ask us the questions later at any time, because we are always here and we're always ready to hear what you have to say. So I do see one question. What software do you use for data placemats, or do you simply copy and paste multiple graphs on a single page? I have not used data placemats a lot. I think Chrissy has used them. So Chrissy, if you want to speak to that.
Well, I was going to tell you that you had questions about data placemats. I haven't actually used data placemats per se, but have done a data walk and have used whiteboards, and which both in Teams, we have whiteboards. And then also Mural, M-U-R-A-L, is another software that I've used and been a part of, where you can put up some of the findings that you have from your research or evaluation, and then be able to sort of go through and talk about the findings and whether or not the interpretation is the same for you and the people who have participated in the evaluation, so that you can make sure that everybody's interpreting things the same way or differently, and then you can discuss it. So that's a nice way to sort of go about that. I think you can also just actually print it out and hand it out as like a PowerPoint slide, might be another way to do it. But I'm sure quick Googles would show you some nice resources as well.
Mm-hmm. And when we post the slides and we post the recording, we will also post some more resources, because I see a question about sharing resources for new data placement users. So yeah, there's some manuals or some guidelines, things like that, that we think are good. Oh, and I forgot at the beginning to have the disclaimer. Any non-governmental resources that we offer are informational. We are not endorsing those things specifically. They're things that we are familiar with, that we may have used, that we're suggesting that might be interesting for you to use as well. We are not giving an official endorsement to those things. So I think that's good. And I will say, without calling out the person's name, she knows who she is. I see one of my colleagues from the old days in graduate school, so I'm happy to see you here. And if there are any other questions or comments, you can always email us at evaluation@hhs.gov. And I believe we have a survey that comes out. And so I'm going to end my time here. As soon as we close this, I believe the survey pops up. We really do want your feedback on this. So Maura, if I'm wrong about the timing of everything, let me know. But I think as soon as we close this, then yes, it will pop up. And the slides will be available. I believe we're going to email them out, but we're also going to post them on Strategic Planning Resource Center. And so we can send that link when we send out the slides as well, so that you will have access to these, as well as the recordings from the last 2 years of other trainings that we have done. So thank you, everyone. And we appreciate you very much. Have a good afternoon.
Thank you so much. And hopefully we'll see you all at our next training, which should be in August.
Yay!
All right. Bye, everyone. Thank you.